Good morning, everyone. This is Jim Morentz of the XchangeCore community. Today we're going to have a fascinating presentation by the Community Clinic Association of Los Angeles County and the Hospital Association of Southern California that describes a healthcare implementation of XchangeCore. We're going to begin by taking a look at the uses made of a tool called Readiness by the Hospital Association of Southern California, and then get a view of the high-level architecture of connectivity and take a look at how the entire effort comes together through XchangeCore. We'll then see an actual demonstration of how this works by Tim Law, who has been the system developer for the Hospital Association of Southern California. We're going to alter the order of our presentation a little bit here since Soraya is not available, and begin with Carlos Casio, Emergency Manager for the Community Clinic Association of Los Angeles County. Carlos?
Basically, we work with community health centers in all over LA County. We provide advocacy, we provide policy guidance, training. We're sort of a hub and spoke of information. And really, as that relates to emergency management, the county, LA County specifically, is in a position to receive the federal HPP grant administered through HRSA, which is typically given at the state level. And so LA County has just been recognized as this, metropolitan high target area, so we have our own sort of unique slice of the pie. And so essentially they work through the healthcare community, hospitals, clinics, long-term care, organizing these agencies to come together and plan and prepare for sort of that all hazards, with that all hazards mentality, right? So my role is to turn around and take that part of the HPP Hospital Preparedness Program money and work with the clinics to develop plans and policies, training around disaster preparedness. And so we work through a number of different means, if it's planning, if it's communications, which we'll be talking about today, training and exercises, and also engaging them in a way that connects to their local partners through what's called disaster resource centers, sort of these hospitals that have been, these acute care hospitals that have been sort of vested with this responsibility of local planning and sort of being the shepherds of very specialized equipment and surge capacities. So essentially we're sort of this hub and spoke of bringing the clinics in and then pivoting to expose them to sort of that larger disaster preparedness community. Can we get the next slide, Jim? And so that's a little bit of background, and essentially the county a couple of years ago said we have a little bit of extra cash that we'd like to use to promote sort of these special projects around the Healthcare Coalition, which is our sort of local healthcare emergency management planning body, so they basically put out a call for proposals saying we have these extra HPP dollars that we'd like to really put out there and see what kind of ideas you guys come up with. So, anybody could really submit a proposal. The clinics we did, a few hospitals did. And so what they were looking for were projects that would essentially enhance the local healthcare system preparedness. So obviously these projects would start very locally. So we're talking about the Clinic Association today. So our project at its inception was very clinic focused, very much focused on what is the FQHC experience and what are their needs. But ultimately part of the need and part of the what they were looking for is, can this be scaled up and can this really be introduced into the larger sort of healthcare preparedness community? And so we did receive the funding, and so part of that was to bring in a consultant or someone that would, we're not in the business of making apps or really in the technology business, but really we had this sort of idea of giving the clinics some meaningful way of enhancing their sort of response capabilities. Clinics, as you can imagine, everyone wears multiple hats. No one's really an emergency management expert. Hospitals tend to, not always, but especially the disaster resource centers tend to have a lot more resources that they can bring to bear. And so really our role is, what can we give the clinics that would obviously be meaningful from a disaster response perspective, but that could also be integrated into their sort of daily workflow, something that makes sense for them, something that's easily adoptable and adaptable. So in sort of our preliminary sort of scheming of what this would look like, obviously I mentioned scalability, not only in the sort of broader healthcare community, but also within clinic organizations, many of which, when you think of a community health center, you may think of maybe just sort of one standalone facility. But the reality is, many of our organizations are fairly large, employing hundreds, upwards of 1,000 employees, and have multiple sites scattered around LA County. So we want something that can be really integrated, that can be really adopted within a facility, and also something that's used across and within an organization. Reliability, if this looks familiar, these sort of terms, it's really just sort of a NIMS way of thinking about communications and information management. We want communication systems that are all these things. And obviously redundancy, and that's kind of where I think on the next slide we'll be looking at that. So essentially we brought on spot-on response. So we had a few conversations early on, and we described to Jim what we were looking for. Really something that, and obviously there's been a lot of iterations of this project, but what we were looking for was some way for clinics to get a handle of, what's going on locally and what information can I share with my response partners, my potential response partners. And up until this point, we had something sort of similar, and Tim will talk about what ReadyNet is, and for us, and I don't want to pigeonhole what their role is, but really for us locally and for the clinics at least, the information that I'm able to get from ReadyNet is very much healthcare focused, and the information that my stakeholders input is very much what they are experiencing, what their needs are, if they are submitting a resource request, things like that. And we've recently introduced what's called the status update. And so what Spot-On Response brought in for us, in addition to sort of this non-healthcare sort of situational awareness, and that was really one of the interesting features, was there's a broader community outside of healthcare potentially contributing to this system, and that information that clinics could really use and leverage to make informed decisions. And so that was really part of the added value, as well as giving the clinics an opportunity to sort of organize or present or display what are their services. So if part of the idea of this planning, and part of the idea of how do we build those meaningful relationships across our healthcare partnerships is, do they understand what resources clinics are able to bring to bear if they're needed? So part of what we established were these clinic profiles. And so these profiles are able to give the user a sense of, this particular organization can offer these services, these are their working hours and things like that. Sort of administrative, but really helpful and probably fairly important in the long run, especially when you're looking for services under conditions of duress. In terms of redundancy, Jim was able to build out, and part of our main project scope was this mobile application, but then also having this web application, this sort of web interface and website that they were able to tap into. Obviously, if we want to be mobile to the extent that we can or the extent that we need to, but obviously there's circumstances where we're just sitting at our desks, and then also having this capacity for this sort of offline access to things like floor plans and emergency plans. So clinics are able to upload these documents, these organization-specific documents that, more and more they're not physical documents necessarily. They're maybe on some internal drive. They may be on the on their desktops, things like that. But then when those systems are compromised, we want to make sure that they have access to the most recently saved documents. So that was part of it. And then the operating status, again, that's something that ReadyNet was able to introduce, as well as Spot-On. And again, that redundancy of just being able to kind of go through complementary systems that giving clinics that option of being able to update their, what is going on, letting the broader community know of what their status is, and giving me, from an association perspective, are my clinics open? Do they have some sort of special condition that I need to be probing and asking them, do you need my support? What can I do to kind of keep you open and make sure you're up and running? Or are they just closed? And so then we can look forward in terms of resource management and providing that sort of common operating picture for the county in general. So that's kind of what we're looking at moving forward. I think I'll pass it along. I think that's my last slide.
Great, Carlos.
Jim.
Appreciate that.
Okay.
And Jim, let me ask you to talk a little bit about the Hospital Association. I'll click down here and take it over.
All right, thank you. So hi everyone. Yeah, my name is Tim. I'm the senior developer or software engineer for Readiness. And Readiness is just a part of the services of Hospital Association of Southern California. And we've been around since I believe it's 1960. And from that time on, we are we serve multiple counties and Los Angeles County, Orange County, and right now we also we serve some of the counties in Northern California as well. And do next slide, please. Thank you, Jim. Yeah. So what is Readiness? Yeah, Readiness is a dedicated emergency medical communication network. It's facilitating the information exchange among the hospital, the EMS agencies, paramedics, dispatch centers, law enforcement, public health official, and other healthcare system professionals in local and regional communities. We collect and share the critical information they need to evaluate and deploy necessary resources during a disaster or the daily operation. Our emergency communication system uses flexible and reliable technology, and is the only system that in the market is using both commercial-grade satellite and local internet access to ensure no interruption in times of crisis and daily operation. So let me show you guys some of the key features of the Readiness. And the very first one, we have a couple modules. What we call is the status module, the mass casualty incident module, assessment module, message module, back capacity, etc. So the first one is called the status module. It's including a complete system for reporting and coordinating and analyzing hospital ED status for all participating hospitals. So every day and every minute, and the hospital will update their status of their emergency department and their availability and how busy they are, so that the people, the hospitals in their areas to aware that how busy they are, and and also the paramedics can dispatch the patients to appropriate hospital according to their status. So and also we have the MCI module. The MCI module is so-called the mass casualty incident. It's doing a disaster, and this module is providing a communication channel among the hospital, paramedics, police, and fire department. And so they could dispatch the ambulance and the patient to the hospital, and so they're aware of how many patients got involved and how many victims, etc. So this is what we call the mass casualty incidents. And we also have the message module. It's just what works like your typical email system. So we have errors and why. Okay. Mm-hmm. So they can send a message between hospitals and tell them what's going on, and etc. So this is a brief introduction of Readiness.
Let's jump ahead here for a quick look at what the project was in relationship to XchangeCore. That's the high level of integration architecture that you see here. And you have readiness over on the left-hand side, spot-on response on the right-hand side, and obviously XchangeCore in the middle. And as Tim mentioned, status and survey are two of the things that ReadyNet does, and we'll see in a minute the clinic profiles and some of the status work on spot-on response. The essential flow is status moves from ReadyNet through XchangeCore and into spot-on response and back again. Along the way, spot-on response adds the clinic profile to the XchangeCore work product, because when other organizations who are looking at it on 911 or a WebEOC or Google Earth or ArcGIS Online see that, they want to see the whole thing. So we're really marrying up the two different components of ReadyNet, which is very much a highly transactional system, and spot-on response that involves profiling and planning and all the other components. The key link between the two is both spot-on response, both XchangeCore in converting, synchronizing, and putting together a secure National Information Exchange Model incident package. But then the way that those two find each other is over on the left-hand side, a clinic lookup that simply matches the clinics that are in ReadyNet, the clinics that are in spot-on response. There are about 170 or so in ReadyNet, 300 and some in CCA-LAC and spot-on response, and the overlap of them is quite a few, well over 100. So it is that lookup that allows one to say, okay, we call this one Joe's Clinic on the left-hand side, and it's 104th Street Clinic on the right-hand side, and we can match all those up. So it's that process that moves the data back and forth through XchangeCore using that clinic lookup information and thus converting it into national standards so that others are able to see it. And then, as Carlos mentioned, there's a community awareness component in the spot-on response in the mobile app and the website that allow that information that's in spot-on response appropriate for the public to be exposed out to the public. Now, one of the things that required was the use of more components of NIEM, the National Information Exchange Model incident definition. There are dozens and dozens and dozens of different elements in there. When the XchangeCore incident work product was created, there were, sort of think of them as the important required components were the ones that were passed back and forth. Anybody can add any additional components to that out of the NIEM incident definition. But there was always this basic set that were part of the incident work product. Although ReadyNet spot-on exchange require the use of a new optional data element that is part of the NIEM standard, and you see in the bracketed funny-looking words there that this calls back and is references NIEM itself, and the red highlights are this data element component, the status issue or identification that has a name. And it is that is a spot-on response ID that is published by spot-on response into the ReadyNet, into XchangeCore. And that is what is used in that lookup table by ReadyNet to say, oh, they're 53513, whatever that number is equivalent to our clinic 91 or our clinic Joe's Clinic. That's the way the matching takes place. So there was some very innovative work done by the technical team in applying the NIEM data into this particular special new need that related to the exchange of status information. So what we want to do now, let's give you a look at this. We'll start out with a quick look at spot-on response for clinics so that you get a level setting of what that is. Each of these logos represents a member of CCA-LAC. The yellow list down at the bottom with all those logos are all of the clinics themselves. When we talk about the profile information and the branding, this logo represents the Readiness Family Clinic, the Children First Early Head Start in Inglewood, address information, website so that someone can go there. This one happens not to have phone and email, but those that do, it's an active email link so people can go up and say, gee, I want to know more about you and make that connection, as well as looking at the website, got hours, services, and this is whatever information the clinic itself has provided. Let's go take a look at another one of these. There's the school-based teen clinic from the Eisner Pediatric and Family Health Center. There you've got the email address and the phone number so that a patient looking for some services is able to say that this person or this organization handles diabetes and pediatrics, and if I want to make an appointment, I can call directly in there. So an outreach component for the clinics themselves when this is on the website or at the point when it actually becomes distributable out to the population itself. At the same time, there's more information that you don't want the public to see. And if I were to pick any one of these other than Community Clinic Association, I would not be able to see it because I'm not a member of that organization. But for CCA-LAC, we see, first of all, just through spot-on response, pretend I'm located over here, and I'm in walking distance over here to CCA-LAC's locations. You see that Carlos entered this information a while back, and there are a couple of plan elements and a resource element. Let's go take a look at the plan. And for this, we just have an example of a floor plan. And if I click on it, that's the Northeast Valley Health Corporation that we've just borrowed as an example and are able to use it to illustrate that this information would be available on the mobile app so that if someone needs that specific information, there's a response plan associated with it. This is a medical clinical emergency template, just one that we grabbed as an illustration because that's the province of CCA-LAC in our demonstration here. We're just using some illustrative examples of the way in which these clinic templates that Carlos and his group have prepared are able to be used by the clinics themselves to develop a better emergency planning component. Then if I go over here to the resources one, you've got an example here of this is a resource request form and instructions that is part of CCA-LAC's routine procedures in making that request. And as well, if this were a clinic, I have the capacity to do a couple of things. First of all, I can come in here and when I wish to change my status, it's simply that I click on my little editor pencil up there, and I've got the closed, reopen, and special condition status. I'll select one of these as a special condition here, and we're going to quickly see that down at the bottom here, CCA-LAC is now a special condition, and if I go back onto the map, we're going to find that it is also represented by a color change and location down here and the special condition associated with that. And that's effectively the quick way that any of these groups can interact and expose their status information off to everyone else, other clinics, and through XchangeCore out to ReadyNet, and it will be offered out to the 911 organizations as well. So with that, let me now turn it over, that you've seen this one functioning, let me turn it over to Tim. You can grab control if you will, and let's give you the opportunity to show ReadyNet.
Right now I'm setting up like two panel. One, the left side is the ReadyNet application. The other side is the spot-on response application. So what we're going to do today is to in our readiness application, what we have is called the, like we mentioned earlier, is the assessment module. Okay. Yeah, under the assessment module, we are showing like all this clinic status, the service status. We have like full service status. We have a partial or limited service, which is translated to spot on. It means special condition, and we also have something called the no services. Right now, what I'm going to do is I'm going to change one of the clinic status from full service to no service. And you will see that change will push it over to the spot-on response application, and you will see that change within 2 minutes. So let's say, why don't we just pick the one that's called Arroyo Vista Figueroa, and then we go ahead and change their service level from full to no service, and we can always give a reason to tell the clinics to say what is the reason why they change the service level. For example, like this one is just called like a doctor's on break, and then we go ahead and we submit. Okay. And on our screen, we see that the Royal Vista is under the no service category right now. And as we said, like it might take up to a minute or two for us to show the changes on spot-on response application. Let's push over to the spot-on response, and you see that the status has changed from open to closed right now. And this right here, this should is open. So under the assessment module, we also we not only can change the service level for the hospital, the clinic, and we also the people also can send an assessment to the hospital and clinic with the question that they need them to answer, so that they could have a better assess of their security. Right now, what we have is called the assessment point is called the readiness drill, and you can see that like under that there's like we have 4 different questions that we are going to ask the clinics. Like where you can have like you can create your own questions in real time, and for example, is what is your name and how's your service right now, and what is your DRC, and how many samples do you have available at this time. So, or you could, if you have more additional questions you want to ask, then you could always to able to create in real time. So in this case, what we're going to do is I'm under the Royal Vista Figueroa clinics right now. I'm logging into, and I could update my answer that I was for this poll. Let's say. Now I'm saying my service level is green. As you see, we are in the full service right now, and when I'm ready, I can just go ahead and click on submit. And under the tab, and we see that like right now we are on 15:53 here, and this is the time that I answer the call. And this piece of information, the answer will also push it over to the spot-on response application and show it in the HTML format. And we can see that when we see that under that on the right hand of like on spot-on, we're now showing a 0 observation. Once when we got the answer from readiness, and it will show 1 observation, 2 observation, etc. So we just go and wait for it.
And you see the bottom right hand corner of each one of those yellow and gray bars, you see that observation just turned to 1. So that means something has arrived there. And Tim's now going to pop that up and click on that special condition. And that, under the observation, he's going to click on that tab and scroll down and click on the blue thing. There we go. And there are the things that you just saw in the other one. How many exam rooms do you have? What are your resources available? What's your name? And the other questions that were there. So they've now, that assessment form now shows up inside a spot-on response, is available to all the clinic people who have access to that and are able to then understand the status and the particular nature of this response. So that, as I look at our clock appropriately coming to exactly 1 o'clock. Nope, then let me say thank you to everybody, and you'll be seeing the announcement of our next webinar coming up in March, and wish you all a good next couple of weeks.